Welcome to today's HealthLine Innovator webinar from the American Association of Kidney Patients, titled Managing High Phosphorus, a Different Approach for Patients and Caregivers. Thank you for joining us today. My name is Jerome Bailey, Director of Patient Engagement and Advocacy for AAKP. AAKP is pleased to host our Innovator webinar series, an extension of our normal HealthLine webinar programming. The content of this program, as presented, and sponsorship support of this webinar is provided by Dialysis. As the oldest and largest kidney patient-led organization in the U.S., AAKP is proud to host this innovative webinar as a service to our expanding national and global communities of patient consumers and their families, medical practitioners, researchers, and policymakers following innovation and advancements in kidney care and treatment. AAKP is an aggressive supporter of innovation to change the status quo of care. While this activity is an approved educational and informational webinar containing branded content, AAKP does not endorse a specific commercial entity or product. Thank you again, Dialysis, for supporting today's program. AAKP's HealthLine and HealthLine Innovator webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of an individual's treatment, and to that end, AAKP is a champion for full patient care choice, the protection of the patient-doctor relationship, and the elimination of artificial barriers and government determinants of health that impede access to all available treatment options. Through our initiatives, we aim to ensure that patients have a central voice in research and innovation. By leveraging the lived experiences and unique insights of the kidney patient and care partner communities, we help drive meaningful advancements across the entire product development lifecycle, from identifying unmet needs and informing clinical trial design and development to shaping regulatory pathways and supporting value, access, and reimbursement decisions. As medical science progresses with personalized medicine, cutting-edge technologies, and novel treatments through this decade of the kidney, the potential for better outcomes in kidney care has never been greater. We are excited to present today's program, which highlights an approach to addressing a long-standing unmet need within the kidney community. Hyperphosphatemia, also known as high phosphorus levels, is a common condition affecting over 700,000 people in the United States who are living with kidney failure. It occurs when excess phosphate builds up in the body and can contribute to serious health complications over time. While dialysis helps manage many electrolyte imbalances, it often does not remove enough phosphorus to maintain healthy levels. As a result, about 80% of dialysis patients need additional therapy to lower their phosphorus level, along with following a low phosphorus diet. Leading up to today's webinar, AAKP conducted an independent flash survey through our Center for Patient Research and Education to learn how kidney patients are managing their phosphorus level. This flash survey is an update to what we first initiated in 2024. We are delighted to share some of the results with you that will help set the stage for our speakers. To walk us through what we learned, I'd like to introduce AAKP's Vice President and Chair of Policy and Global Affairs, Paul Conway. Paul is a passionate advocate for patient-centered care, patient participation in true shared decision-making, and the use of patient insights in kidney research. As a kidney disease patient himself for 49 years and a 29-year transplant recipient, he has been recognized for his advocacy work with several national awards, including the President's Medal from the American Society of Nephrology and the Presidential Volunteer Service Award for Lifetime Achievement. Paul has served in 4 U.S. presidential administrations, including as Chief of Staff for the U.S. Department of Labor. He was selected by the FDA to serve as the inaugural chair of the FDA's Patient Engagement Advisory Committee and has served on the American Board of Internal Medicine, Nephrology Specialty Board, as well as multiple CMS technical panels related to dialysis quality improvement measures. Paul joins me right now, and I will hand it over to him.
Thanks, Jerome, and thanks for putting together today's Innovator webinar. This is a very important issue, and your ability to put these together, Jerome, and to keep the programming positive for patients at AAKP is absolutely wonderful. So, in the survey that Jerome just talked about, we went out and talked to patients and caregivers and healthcare professionals on a very particular issue, which was about ongoing access to therapies so that the right patient at the right time gets the right drug. And in particular, new innovations in therapies for lowering high phosphorus levels. This was an update to a survey that we had done in 2024. As many of you can relate, and as I certainly related when I was on dialysis managing phosphorus, taking a lot of pills to manage it is status quo care for many people. We asked this particular question because we learned that some federal officials were largely unaware of what we call pill burden that patients endure with conventional approaches to managing their high phosphorus. And so we're interested for survey respondents in asking how many pills per day they or their loved ones take to manage their meals and phosphorus. And you can see here patients taking 1 to 9, 67%, 10 to 15 pills, this is per meal, 21%, 16 to 20, 7%, 21 or more, 4%. Now, the simple math on this is this. If you're doing this 3 times per day, that means that 67% of the folks are taking up to 27 pills per day. And if you do the math on that, that's thousands of pills per year. That's pill burden. We were very surprised that federal officials simply were not aware of that. And we don't think that's acceptable. On January 1st, 2025, with very little engagement with the patients and the kidney expert community, CMS implemented a payment policy that severely restricted patient-provider access to new oral-only innovations in phosphate-lowering therapies, or PLTs. So we asked this question: do you believe federal agencies like CMS should act with more transparency and involve more patients and kidney experts in decisions that directly impact kidney health and patient outcomes? 90% of our survey recipients indicated yes, 3% said no, 7% were uncertain. This is what we call government determinants of health, when government makes decisions that negatively impact kidney patients without ever working with them or consulting with them or working with the larger stakeholder community of kidney experts and kidney advocates. So we asked, as a patient or a care partner, generally speaking, do you believe your or the patient's ability to manage phosphorus successfully improved or worsened since CMS implemented their 2024 policy decision on January 1, 2025? Significantly worsened, nearly a quarter of the respondents said that, 22%. Somewhat worsened, 31%, stayed the same, 25%, somewhat improved, 3%, significantly improved. I'd call attention to the first two numbers there. Significantly worsened and somewhat worsened. That's a total of 56% of the respondents, indicating that the change in CMS policy that was dated in 2024 and implemented in January 1, 2025, half your patients were negatively impacted. And the feedback from medical professionals will be interesting. We'll get to that soon. On the next question, we wanted to gauge what the level of understanding was among patients and other respondents about what the consequences were of inadequately monitoring and managing phosphorus. Now, taking all those pills is for a reason, and the reason why is because of the negative potential consequences of high phosphorus. These include calcifications of blood vessels, bone loss and fractures, stiffening of blood vessels, heart failure, and early mortality. We were pleased to see that 54% of the respondents were very well aware of what the risks were of not adequately managing phosphorus. 27% were somewhat aware, 8% were slightly aware, 9% not aware at all. From an education standpoint, we're very focused on those who are slightly aware and not aware at all, the 17%. But I would call attention to the fact that in the first two numbers here, those who are very aware and those who are somewhat aware, it's about 81%. So you're dealing with a patient population that knows full well what the consequences are if their phosphorus is not managed correctly, meaning These are patients that need the right medicine at the right time because they know what the risk is to their life and their livelihoods if they're not managing their phosphorus correctly. We also asked if folks were aware that inadequate management of phosphorus and those impacts on the cardiovascular system can have an impact on transplant readiness and long-term transplant outcomes. Again, 53% indicated they were very well aware, 16% indicated they were moderately aware, 13% slightly aware, 16% not aware at all that it was new information. Again, from an education standpoint, AAKP will be working very diligently to make certain that the 16% who are unaware at all about the impact on transplant readiness are educated. The good news is you had 69 to 82% of folks with some understanding of the fact that their eligibility and their strength and readiness for a transplant can be negatively impacted. When you think about the implications of that, of not managing your phosphorus correctly and potentially risking your opportunity to get a kidney transplant, we believe it makes the argument very squarely in favor of patients that they have access to the right medicine at the right time, and especially access to new innovations that would make it easier for them to manage their phosphorus. We also asked whether or not, since the policy was implemented on January 1, 2025, have you experienced any disruptions in your ability to prescribe phosphate-lowering medications to your patients? We put this question to the medical professionals specifically. And here you had nearly 60% of your medical professionals. See, these are the frontline folks in dialysis centers working with patients. Nearly 60% indicated that they had had an issue since this policy was implemented. 26% said no, 15% were unsure. And here are some of the comments that healthcare professionals that work with patients actually said. You have a healthcare provider here who said patients' Medicare insurance has to contract with our dialysis providers and pharmacies, and this limits which binders the patient is able to receive. It continues to take at least 7 to 10 days for a patient to actually receive their medication. And you have two other comments here that people made. These are frontline medical professionals who understood the negative implications and practical considerations of the implementation of CMS's decision to limit access to phosphate-lowering therapies. It's a sad story. And then we asked medical professionals whether or not they had to make any recommended changes to patients' diet, lifestyle, or treatments plans because of issues obtaining phosphate-lowering therapies, again, after the January 1, 2025 implementation. 58% said yes, 32% said no, 10% were unsure. This means that medical professionals had to invest additional time with patients to work around the issue of lack of access and then recommend even more changes to a dialysis patient for their diet, their lifestyle, and their treatment. You can see the reverberations of a government determinant of health and bad policy right in this slide. Then we asked how aware medical professionals were of inadequate phosphorus management in regard to transplant readiness and acceptance into a transplant program. Like, are the frontline medical professionals, do they really understand this? Here, 81% of your medical professionals were very well aware of the fact that inadequate phosphorus management can negatively impact acceptance into transplant. 12% indicated they were moderately aware, 5% slightly aware. The great news about this is there's a very high understanding among medical professionals about the implications of poorly managing phosphorus for their patients, especially those patients that they work so hard to get a transplant for and that opportunity to change your life. And we asked, do you agree that kidney patients and physicians that they choose to treat them should have access to all new and safe FDA-approved kidney medications designed to improve patient health and decrease the burdens associated with other older types of treatments? 98% of the patients, the caregivers, and the medical professionals said yes. Patients should have access to those new innovations that CMS has restricted, but that the FDA had approved. So where do we stand on this? Well, it's quite clear that CMS made a decision in 2024 to change policy and your access and patient access to phosphate-lowering therapies. It has negative implications. And again, this is what we call a government determinant of health. Patients were not consulted. The medical professionals that we trust The fine professionals at the American Society of Nephrology and the Renal Physicians Association, they were not consulted. So this is bad policy coming from a federal agency that was implemented on January 1, 2025. So an agency can go ahead and make a lot of different decisions, but when they make a decision that negatively impacts patients, we call that a government determinant of health. And when it puts at risk your opportunity to manage your life and could potentially put your access to a kidney transplant at risk, we think it's time to get motivated and to engage in the policy process. These are the types of decisions that have real serious consequences for patients and for loved ones. And this is why AAKP does what we do best, which is on the advocacy and education sides of the aisle. We work really hard to make certain that patients understand the implications of managing their conditions. But when the government gets in between the patient and the doctor and makes it harder to manage your life and to maintain your livelihood, we act. We raise our voice together and we advocate. And we advocate for innovations and ongoing patient access to those types of innovations that can help save our lives and make it easier to be a kidney patient. Jerome, I'll go ahead and throw this back over to you. Again, thank you very much for this Innovator webinar and this very timely issue.
We appreciate you, Paul. Thank you very much. We want to thank everyone who took the time to provide feedback on our survey. It is clear that there is a significant need for more education and awareness surrounding the management of hyperphosphatemia to help improve individuals' quality of life. Now to our speakers. Our first speaker is Dr. David Spiegel. Dr. Spiegel is a national and international figure in nephrology. Prior to joining Ardelyx as Vice President of Nephrology, Dr. Spiegel served as the global lead for the clinical development for the nephrology therapeutic area of Vifor Pharma and Executive Medical Director of Nephrology at Relipsa. Before entering the pharmaceutical industry in 2013, he was a professor of medicine at the University of Colorado Health Sciences Center and served as the medical director of the ESRD and CKD programs. During his academic time, he contributed to important research in advancing the field of calcium and phosphate metabolism in CKD and its role in vascular calcification and cardiovascular disease. Dr. Spiegel, thank you for joining us. I now turn the program over to you.
Thank you, Jerome. It's a pleasure to be able to present today. Let's take a closer look at phosphorus, what it is, and why you might need a different treatment approach to help lower your serum phosphorus. Phosphorus is an essential mineral that helps the body function properly. Phosphorus is found in the foods you eat, including dairy and meat. It is also added as a preservative to many foods, especially fast foods, beverages, and even some medications. So let's discuss why it's important to control your phosphorus and how you might do that. Everyone needs phosphorus, but too much can be harmful to patients on dialysis. Your body absorbs phosphorus from the foods you eat. When your kidneys are not working well, they are not able to remove extra phosphorus from your blood. As a result, the extra phosphorus builds up in your blood. This condition is called hyperphosphatemia. Over time, too much phosphorus can lead to serious health issues in patients requiring dialysis, including weakening of the bones and heart and blood vessel problems. Knowing your target phosphorus goal is an important part of your treatment journey. A common treatment goal is to try to keep the phosphorus level at or below 5.5 milligrams per deciliter. However, the normal phosphorus range is actually 2.5 to 4.5, and the latest guidelines suggest we should try to achieve this normal phosphorus level. So you should talk to your doctor about your goals, work with your caregivers, loved ones, and care team to track your progress together. Managing phosphorus typically starts with the combination of diet, dialysis, and treatment with a medication called a phosphate binder. Certainly, making healthy diet choices is important. Your doctor and renal dietitian will probably recommend a kidney-friendly diet which consists of choosing low-phosphorus, protein-rich foods, including fresh and whole foods, and limiting processed foods and drinks. Dialysis treatments also help remove some, but not enough, of the phosphorus from your blood. So understanding how to manage your phosphorus levels between your treatments is also important. When dialysis and diet are not enough, your doctor may prescribe a phosphate binder to help manage your phosphorus levels. These steps are part of a daily routine, and caregivers or loved ones can help you stay on track. What is very clear is that managing phosphorus is a team effort. Support from your caregivers or loved ones can show up in different ways throughout your treatment journey. Your caregivers and loved ones support you by helping you stay consistent with your routine, supporting you through everyday challenges, joining conversations with your doctor, and encouraging you along the way. However, we know that even with the right amount of support, it can still be hard to keep your phosphorus levels in range. Approximately 70% of patients with chronic kidney disease on dialysis who are treated with a phosphate binder still struggle to get their phosphorus to goal and keep it there. If that has been your experience, you are not alone and you are not out of options. So you should consider taking a different approach and blocking phosphorus with Exfosa. Exfosa is a different approach to lowering phosphorus. Exfosa, approved by the FDA in 2023, is a prescription medicine used to reduce serum phosphorus in adults with chronic kidney disease on dialysis as add-on therapy when phosphate binders do not work well or when phosphate binders cannot be tolerated. In the past, phosphate-lowering medications were limited to the use of phosphate binders such as Renvela, Velphoro, and Auryxia. Exfosa is not a phosphate binder, it is a blocker. Let's dive a bit deeper to learn more about how Exfosa works. Exfosa works differently than phosphate binders. First, phosphate binders can be thought of as working like a sponge. They soak up some of the phosphorus in your gut, keeping it from entering your bloodstream. But if you think about a sponge, it only works if it is there when and where the spill happens. Imagine spilling a drink in the living room, but your sponge is in the kitchen. It can't do its job. Also, a sponge can only hold a certain amount of liquid, so a lot of sponges are needed to mop up a large spill. Binders work the same way. They must be in your gut when phosphorus is present. That's why phosphate binders need to be taken with every meal. Exfosa is not a binder, it's a blocker. Exfosa works like a roadblock, blocking some of the phosphorus from getting into your bloodstream. Just like a roadblock stops traffic, Exfosa blocks phosphorus when taken as one pill twice a day. That's why Exfosa is taken right before the first and last food of each day. This slide shows some important Exfosa safety information. The indication for Exfosa is that the 30 milligram twice a day tablet is a prescription medication used to reduce serum phosphorus in adults with chronic kidney disease on dialysis as add-on therapy when phosphate binders do not work well or when phosphate binders cannot be tolerated. As far as important safety information, the most important information about Exfosa is that Exfosa may result in softer and more frequent bowel movements. Also, do not give Exfosa to children who are less than 6 years of age. And do not use Exfosa in children who are less than 6 years of age or patients who have a suspected bowel blockage. Before taking Exfosa, you should tell your healthcare provider about all of your medical conditions, including if you are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. Also, do not take Exfosa with stool softeners or laxatives. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Exfosa can cause serious side effects. Diarrhea is the most common side effect of Exfosa, and it can sometimes be severe. Call your doctor if you develop severe diarrhea. These are not all the possible side effects of Exfosa. Call your doctor for medical advice about side effects. You may also report side effects to the FDA at the phone number shown on this slide. You may also report side effects to the FDA via the website also shown on this slide. And for additional information, please see the full prescribing information available at this presentation. Exfosa is dosed as one pill twice a day, taken before you eat your first food of the day and your last food of the day. This is both your starting and your maximum dose. Do not take more Exfosa than the dose prescribed by your doctor. If you miss a dose, skip that dose, but take your next dose at the regular time. And again, do not take stool softeners or laxatives if you are prescribed Exfosa without talking to your doctor. And do not take Exfosa right before a meal, right before a hemodialysis session, as you may experience diarrhea after taking Exfosa. Instead, take that dose before your next meal after dialysis. And very important, do not adjust your dose without speaking to your doctor. Are there potential side effects of Exfosa? Of course. You may experience diarrhea, looser stools, and/or more frequent bowel movements with Exfosa. These changes are expected and reflect how Exfosa works in your body. Exfosa works by blocking phosphorus from being absorbed into the blood from the gut, but it also prevents some sodium from being absorbed, which increases the amount of sodium and water in your stool, making it softer and causing more frequent bowel movements. Diarrhea is the most common side effect. It is typically mild to moderate, but may sometimes be severe. If you experience diarrhea when taking Exfosa, it will likely happen soon after you start and may go away or improve with continued treatment, or your doctor may lower your dose. The diarrhea reported with Exfosa was typically reported soon after initiation of treatment, but could occur at any time during treatment. Certainly, call your doctor if you develop severe diarrhea. Keep in mind that during the clinical trials of Exfosa, participants were allowed to use antidiarrheal medications like loperamide to manage diarrhea. So ask your doctor about the use of antidiarrheal medications. So it's time to think about a different approach. Consider blocking phosphorus to lower your levels. You should certainly feel free to speak to your doctor about Exfosa. Before we end this session, I want to speak directly to caregivers. Your well-being matters also. Supporting loved ones with chronic kidney disease can be rewarding, but can also be demanding at times. Taking care of yourself is an important part of that journey. Try to take breaks when you can, ask for help from others when needed, stay connected with family, friends, or support groups, and most importantly, talk to your healthcare professional if you ever feel overwhelmed. Remember, even small moments for yourself give you the energy to support your loved ones every day. So thank you all for your attention today, and I'm going to turn the program back over to Jerome.
Thank you, Dr. Spiegel, for that informative presentation. We really appreciate you being with us today. Our next speaker is Chrissy Huffman, an AAKP ambassador and two-time kidney transplant recipient from Jacksonville, Florida, who has been living with kidney disease for more than 22 years. Throughout her journey, Chrissy has experienced in-center hemodialysis, peritoneal dialysis, home hemodialysis, and two kidney transplants. She was treated with Exfosa for hyperphosphatemia while on dialysis. Today, Chrissy is a dedicated advocate who shares her story to inspire and support others navigating kidney disease. Chrissy is being compensated by Ardelyx to share her experience. We're so pleased to have her with us. Hi, Chrissy.
Hi.
As you first started dialysis and managing phosphorus became your life, part of your life, what was the hardest part of that period for you?
I was 23 and pregnant with my third son when my doctors discovered that my kidneys were shutting down. Thankfully, I was able to deliver my healthy baby boy around 38 weeks, and about a year later, I started dialysis. As a single mother raising three young children on my own, it was especially difficult for me. There's so much to learn, and it's very overwhelming. One of the many new priorities that my doctors discussed with me was about needing to keep my phosphorus under control. I was already juggling all that comes with dialysis and taking care of my kids, and now I needed to add all these dietary restrictions and binders to my list. It was all too much. My phosphorus levels were high throughout my entire time on dialysis. I felt frustrated despite all my efforts.
can you talk about, how did you find out about Exfosa?
Hmm. Well, Exposa launched, and my nephrologist immediately came to me and brought it to my attention as another option to add onto my treatment. And I was game to try something new because I've tried everything. After starting Exposa, my phosphorus levels came down to a normal range for the first time in my life.
What does it mean for you to get your phosphorus under control?
I feel hopeful again. I'm motivated to be a kidney advocate and share my story with fellow patients and return to work. If I can help one person to realize it's not the end and it'll be okay, that's all that matters. I feel like I can start planning for what comes next.
Last question for you. What does life look like for you post transplant?
I can look forward to the future, and I'm excited about what's ahead for me and my family. I'm reminded that there's still so much life to live and to look forward to. I can focus on my family and my advocacy and whatever's coming next. I know how lonely and overwhelming kidney disease can feel. If my story helps one person feel less alone, then it's worth sharing.
Thank you so much, Christy, for sharing your remarkable journey with us today. Your story is a powerful reminder of the resilience, determination, and hope that so many kidney patients demonstrate every day. If anyone watching has additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. If you are not already a member of AAKP, we encourage you to join. AAKP offers free memberships to patients, their family members, as well as living kidney donors. To become a free member, join online at aakp.org/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change status quo kidney care. You will also receive a digital subscription to our bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. We also invite you to check out our blog to read some great articles and patient profile stories, and follow us on social media for all the latest news and to keep up on what's trending. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their healthcare. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download free of charge, including titles such as the Understanding Food Nutrition Facts label or the Bone and Mineral Disease Information webpage. You can also order materials by phone. We are excited to announce the date of the AAKP Public Policy Summit. The 9th annual AAKP Policy Summit will be held on July 23rd at the National Press Club in Washington, D.C. Registration for this free event is now open, and a virtual option is also available for those unable to join us in person. We are also excited to that registration is also open for the AAKP National Patient Meeting. This event is taking place September 11th through the 13th at the Little Rock Marriott in Little Rock, Arkansas. The AAKP National Patient Meeting, the largest kidney patient conference in the U.S. with a growing international audience, features a diverse lineup of speakers crossing all sectors of the kidney community. Visit the AAKP website to register and make your hotel reservations today. Please continue to visit our website and follow us on social media channels to keep up to date on the latest event information. Finally, you can visit our special AAKP OnDemand webpage at bit.ly/AAKP OnDemand to watch a number of great presentations and webinars, all available on demand from our 2025 events and programs, as well as the 2026 programs as they occur. You can also visit the AAKP YouTube channel at bit.ly/AAKP YouTube for more great content. AAKP thanks our Dialysis for the sponsorship of today's program. We would also like to extend a heartfelt thank you to our webinar speakers, Dr. David Spiegel, Paul Conway, and Chrissy Huffman, for graciously participating in today's HealthLine event. Their expertise and insights greatly enriched the discussion and provided valuable information. And thank you to everyone who joined us.